listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, ready to scale but not sure where to start? Maximize your reach by branching out. Diversify your insurance portfolio and reap real rewards. Written by Isabel Vitale. You know the saying, don't put all your eggs in one basket? Diversifying is good for many types of businesses, and your insurance business is one of them. Being able to sell more than one or two types of plans to your clients can boast many benefits. Let's explore the top reasons to expand your insurance portfolio beyond Medicare and how to do it. First off, you know I love a good working definition. So let's start with what it means to diversify your portfolio. As you're likely already familiar, an insurance agent's portfolio includes all the different plans for which they're contracted and can offer to clients. For agents in the Medicare business, these might include Medicare Advantage or MA plans, Medicare supplements or MedSups as we call them, and prescription drug plans, which are often referred to as PDPs. Diversifying your portfolio means either contracting to sell new types of plans or products that you don't already sell, or contracting with new carriers for types of plans you do already sell. And of course, you can always do a mix of both. These could include more health plans or non-health insurance options like ACA or marketplace plans. We also refer to them as under 65 plans. You can add dental, vision, and hearing, or DVH plans, short-term medical, limited medical benefit, short-term care, home health care, long-term care, accident, hospital indemnity, critical illness, cancer, stroke, and heart attack, life, final expense, and annuities. There are a lot of options. Expanding your plan and product offerings is essential to the growth of your insurance business. Let's talk about why it's a good idea to diversify next. Think about the last time you went grocery shopping. Were you able to get everything on your list from one store? Or did you spend all afternoon store hopping and running down your gas tank? Who wouldn't like the convenience and efficiency of shopping at one place? You can be that one place for your client's insurance shopping list when you start diversifying. One of the biggest benefits of adding to the number of plans and products you sell is being able to reach more prospects. You can sell to the whole family. With the number of multi-generational households quadrupling since 1971, well-prepared insurance agents can quite literally cover an entire family in one swoop. This means you can sell grandma and grandpa Medicare benefits, while offering marketplace plans to mom, dad, and their children. And then even better, you can present DVH plans to all the family members we just mentioned, as well as a slew of other ancillary products to benefit each unique situation and person. This is possible even if these family members don't live in the same household. If you prove you're a reliable agent, your clients will likely recommend you to their family members for their insurance needs. Another benefit, diversification allows you to meet different budgets. Having more plan options in your toolbox means exponentially more plan configurations to fit what your expanded client base can afford. Many people have limited incomes. In fact, KFF reports half of all Medicare beneficiaries had incomes below $36,000 per person in 2023. While half of all U.S. adults say it's difficult to afford healthcare costs. Healthcare is expensive, and costs only increase as each year passes. In 2024, Fidelity estimated that someone retiring at 65 years old could expect to spend an average of $165,000 in healthcare and medical expenses throughout retirement, even with Medicare coverage. So it's important that your clients use their money wisely when selecting a health or ancillary plan, as it could help shield them from high out-of-pocket expenses. The good news is that with different plan options, you can better find one or more that works for each person's financial situation. Take a look at your market and see which plans and carriers are competitive. Carriers with plans that offer financially helpful benefits, like the Medicare Part B Premium Giveback, are definitely ones to consider adding to your selling options. In addition, certain med subs can be competitive options you can offer clients with budget concerns. Moving on to our next benefit. A diverse portfolio can mean more diverse needs beyond those that are monetary. When you expand, you'll be able to assist more prospective clients based on their varying health statuses, ages, and preferences. Younger generations might be interested in life insurance. Those individuals with certain risk factors might want a cancer or critical illness plan. Someone between primary medical plans might want a short-term medical policy. A snowbird or travel enthusiast may be interested in a med sub. And think, with a diverse portfolio, you could sell a suitable plan to each type of person. Diversification also means being able to cross-sell to your current clients. They already bought from you once. Chances are good they'll do so again, especially if you've prioritized relationship building, formed a connection, and truly understand their needs. Having both Medicare and under 65 plans in your portfolio could be helpful if there's an age gap between a couple where one is eligible for Medicare and another isn't. You can insure both. However, Medicare or ACA plans may not always cover other expenses, such as prescription drug costs, dental, vision, or hearing costs, various copays, and more. It's a good idea to keep some ancillary products packed into your portfolio as well to complement your primary plans. Take your business to the next level by bulking up your portfolio. This can be the difference between being a beginner versus a more seasoned agent, or engaging in a part-time hobby versus a full-time career. Having a diverse repertoire of plan options enables you to scale your insurance business effectively, especially if you're seeing signs that you need to expand your insurance portfolio or feel like you're self-sabotaging your sales. It's time to strategize and map out a plan for a diversification growth strategy. These are some signs that it might be time to scale. Clients are asking about a product you don't sell. You haven't added a new product in a while. New contracting opportunities became available, or your portfolio can't provide full coverage. If any of these are true for you, then start researching new plans in your area and brainstorming which might be the most useful to your clients. Now, let's talk about the ability to sell year-round. If you're in the Medicare world, you know that the bulk of your business comes during the annual enrollment period. AEP runs from October 15th through December 7th. The rest of the year, the lock-in period as we call it, agents can see a big dip in sales. The best way to combat a dry season? You guessed it, a diverse portfolio. Offering marketplace plans means you'll be able to capitalize on another busy season, the ACA Open Enrollment Period, or OEP, which typically runs from November 1st through January 15th. During the rest of the year, you'll be able to use initial enrollment periods and special enrollment periods to enroll clients into primary health plans. Ancillary plans and life insurance can be sold all year, potentially bringing a big boost to your lock-in period. Think about it this way. If the average millionaire has 7 different sources for income, we feel confident saying that diversifying your portfolio increases the potential for you to earn more commission. Now, potential is just that. More commission will not magically appear in your bank account. You'll need to put in the consistent work of finding more quality leads for your new plans, meeting and presenting options, and closing deals. But you can't sell plans you're not contracted for. So diversifying is the first step to generating new income streams. And being in the industry we're in, let's talk about risk. A diverse portfolio provides a safety net for your income. If one product or insurance line is having a tough year, you have other products you can sell to keep earning. Or perhaps you're tired of compliance regulations for certain plan types and want to switch your focus. Doing so isn't a heavy lift if you're diversified. Last on our list of benefits, branching out can help boost client retention and loyalty. Another powerful result of portfolio expansion that will really take your business to the next level is improved client retention and loyalty. Your clients will be able to trust that you have a plan type to fit their needs and are always ready to help them explore the right fit for their unique circumstances. Let's return to that grocery store analogy. You want to be the superstore to their insurance needs, so they'll keep coming to shop again and again. And better yet, satisfied clients refer people and places to their friends and family. Okay, now that we have a good understanding of why you should diversify, let's explore how to make it happen. Contract with different carriers. One of the quickest ways to diversify is by contracting to sell new insurance carriers for Medicare products you're already familiar with. You'll already have completed some of the necessary Medicare training courses and certifications. For different carriers, you'll simply need to sign the contract and complete any necessary carrier-specific product certifications. Carriers have a few different characteristics to consider. And if you don't have these types of carriers in your portfolio, consider adding one of the following: national versus regional. For example, if you've got all the national players but don't have any regional carriers, or maybe you're the opposite and you have all the regional carriers but you're missing one of the top market carriers. Other considerations to think about: carriers that are highly recognized, strongly rated, stable, new and innovative, carriers that are one-stop shops, carriers that specialize in a certain product, as well as those that feature different formularies or networks. Remember, this is a quick and simple diversifying win, so we recommend starting here when mapping out your strategy. Another important step to take when diversifying is to contract for various product types. Let's go through some of the different categories of products you could potentially sell. In the health category, we have all of Medicare. So MA, MedSup, and PDP. We have under 65 ACA products and short-term medical plans. In the ancillary category, there's long-term care, short-term care, home health care, DVH, critical illness, hospital indemnity, as well as cancer, heart attack, and stroke insurance products. Other categories that get a little more complex: life and final expense, and then annuity products. Obviously, different product types are a must if you want to start cross-selling. And if you're wondering which plans to start adding to your portfolio first, start by asking your current clients. Send them a poll with a list of products you're considering to gauge their interest. Then, won't it feel nice to reach back out to them and notify them that you now sell that product? Finally, you can also add different types of plans and benefits for enrollees within a product type. Here's a breakdown of how to expand your offerings this way. Back to the Medicare category. Adding special needs plans like dual eligible and chronic condition, not so much institutional, but Other plans in this category include the Medicare Medical Savings Account, or MSA, Medicare Advantage only, or Medicare Advantage with prescription drug coverage, so MAPD plans, MedSups and PDPs for those with original Medicare, and then 5-star MA plans, as well as 5-star PDPs. You can round out your network options by considering HMO versus PPO in Medicare Advantage plans. For ACA plans, you'll have PPO, HMO, EPO, and POS options. There are national versus regional network options. And then there are also options for travelers, like a MedSup versus homebodies with an HMO MA plan. Another consideration, the approaches of medical benefit. Do you have a holistic option? What about functional? There's also integrative, traditional, and formulary differences. And then we touched on this one earlier with options for different budgets. That applies here as well. You'll want to consider different costs and levels of affordability. That includes low to no premium options, high or low deductible options, and different copay options. As you can gather, even within certain product types, many opportunities for diversification exist. And if you're feeling overwhelmed with all the ways you can expand your portfolio, we get it. That is also why the team here at Ritter Insurance Marketing is here to help. We recommend reaching out to our sales team and having a conversation about the next steps. They can review your portfolio, go over the plans you currently offer, and suggest which additions make sense for your local market and your business goals. Also included with that portfolio review, agents get a free Ritter Smart Sheet that is customized to your local market, and it details competitive carriers and plans where you're selling to help in your decision making. You can claim your free portfolio review with the link in our episode notes. And if you're not already working with us, no worries, they can help you get your registration squared away at the same time. Diversifying your portfolio is one of the insurance selling strategies that's essential for the long-term health of your business. Besides taking your career to the next level, expanding your plan offerings can boost client retention and referrals, grow your list of prospects, and better meet the different needs of your current and future clients. Consider one new carrier or product you'd like to add to your portfolio and take action today. You can get your portfolio review started by clicking on the Claim Your Free Ritter Portfolio Review link in our episode notes. Thank you so much for listening to this installment of our Agent Survival Guide podcast. We will see you next episode.
The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Isabel Vitale. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Rate and review our show on Apple or Spotify.